Hi, everybody. I'm glad you're here. Don't know what your weather's doing, but in our last 2 days, we've had over 3 inches of rain in our area, so we're just kind of all swimming everywhere we go. I'm Nancy Phillips. I coordinate the Illinois Family Resource Center. It started in 2015. It was supposed to be a pilot program, and we're still chugging along. You will see Christina Banda's name in the chat, and she is the counterpart in Chicago area. So if you need anything, she's going to jump in and be glad to fill in some things. We are part of the Division of Behavioral Health and Recovery, and we are a statewide program that the Our House in Charleston, Illinois oversees. And I encourage you to take a look at our website. We'll put that in the chat here pretty soon. It'll be about 2 weeks before we have the certificates out when we're done. You have to be in attendance, and we will check the timing and make sure it's a reasonable time because for the people that join us and do what you need to do, I know you get called away, and if there's a problem or something, just let us know. I also want to encourage you to take care of yourself. If something comes up that triggers anything, by all means, take care of yourself. I think this is going to be an exciting workshop, though. I'm so thrilled. Okay, I want to share a couple of things. Been in this field over 40 years, and one of the best things that happens is the people I meet and that enter my life. And some of them have entered my life for life. And one of those people is sitting right here and is going to present today. No matter what happens, Megan's going to be a part of my memories and important to me. She's the executive director of the Southern Illinois Resource and Advocacy Center, known as CIRAC. And several years ago at a Prevent Child Abuse conference, she's from Southern Illinois, I'm from Central Illinois. We were doing a conference table and she just stopped by because we were supporting a program that it involved children. She was interested in it. The next thing we knew, time had just passed and we were still talking. And I thought, I'm going to go to this lady's workshop. So I went, and here she was on stage, bouncing all over the place, got hot, flipped her hair up on top of her head. And I said, I love this lady. I got to have her do something for us. And that's the history. She's been doing some of our webinars and training. I've been in Southern Illinois and done some work with some programming as things have developed. And one of the things that is really most special, those of you that are familiar with the Circle of Care project that we did year before last that addresses grief and loss with children impacted by substance use disorder, Megan was one of our lead consultants on that and an extremely important part of the outcome, tremendous outcome of that. So I am going to turn this over with Megan. She can share what she wants to about herself, but you're in for a good time. And Megan, it's yours.
That usually, Nancy, and you know this about me, usually introductions make me really uncomfortable because I'm always just kind of sitting there, but that was a really good one. And thank you so much. I couldn't have told that story better myself. It happened exactly like how Nancy said. I happened to stop by her table, and before you know it, we were trying to solve the problems of the world and trying to
Mhm.
save all the children. And then, the rest is kind of history. And so
Mhm.
it's been, it's been, let's see, that would have been when 2023, I think.
I think so, 22
Yeah.
or 23.
Yep. So that's been a
Yeah,
few.
we were in Naperville, a long
Yep,
way from
we
home for
sure
both
were.
of us.
We sure were. We sure were. So that's one of the great things about this field is really forming those connections and meeting those people sometimes that your paths cross with in the most unexpected ways and forming those connections that just stay with you. Like you said, they just stay with you. And so I say all of that because today in this presentation, we are going to talk a lot about connection. Um, if we're talking about family peer professionals and we're talking about what that role looks like, the power of that role and how that goes, then we really have to acknowledge that the power in that, if that family peer professionals have often lies in their ability to build connections with their participants or their clients. So I am super excited to dive into this presentation with everyone this morning. I will let everyone know that this is my very first time doing this presentation. So this is a new one with a lot of new content. And I honestly, I have not racked my brain over a presentation probably this hard in quite a while because this is a topic that's very, very important to me. And I want to make sure that we are doing it justice. So, as Nancy said, my name is Megan Ragan. I am the executive director of the Southern Illinois Resource and Advocacy Center. One thing we're going to talk about in a moment is what family-run organizations are, and I say all that because CIRAC is a family-run organization, and that ties directly into family peer professionals and their roles and all the different things that they're able to do in the continuum of services. But we will get into that here momentarily. So I know that Nancy had several of you already put into the chat, where you're located, and I love to see the geographic spread. It seems like we have folks from all over the state in here, which is always super exciting. Anytime that happens, I'm always just so grateful that you all, took the time out of your day to listen to me talk about something that I care about. And so I appreciate that. One thing we didn't cover yet, though, in introductions is a couple of these questions, but the one that I really want to focus in on, just to kind of get us into this reflective mindset, because that's a really important part of our conversation today, is reflecting on ourselves as people, as service providers, and also on the people that we try to help. Can you tell me, and you can, I'm not sure if you can unmute with this being a webinar, but if you can't, that's fine. Go ahead and put it in the chat. Can you tell me what is the most important part, in your opinion, of the work that you do? And I'm just going to pull open that chat here so that I can see. And I realize that's a hard question because most of us in this field feel like all of the parts of our jobs are important, right? Everything that we do is important because everything is connected to something larger than us. Harm reduction, helping the family. Yep. Advocacy. Absolutely. Okay. All right. Most important part of the work that I do is making healthy change. Yep. Having a patient feel seen and heard, that is absolutely so important. Giving kids a voice and showing them that we care and then being authentic, providing and instilling hope. Okay, work on a mobile crisis team. Very nice. Walking next to the people in the hardest times that they'll go through. Yes, 100%. Getting to know your participants and letting them know that they aren't alone. Yep. Partnership and meeting them where they're at, using strengths to promote positive growth. Yep. So are we seeing a theme with all of these things? Are we seeing a theme with all of the things that everyone put into the chat? I see a theme very, very clearly. And this is something that all of us do. This is something that all of us should be doing in our roles, and this is something that really sets our field apart from so many others. And that's in this, the relationship and the connection are prioritized, right? All of these examples here, everything that we're talking about, whether it's getting to know your participants, letting them know that they're not alone, partnering with your participants, walking next to people as they're navigating really difficult situations, empowering families, all of those different things are built on relationships, right? So today we are going to talk about a new type of peer. Now, most I would assume that most everyone here has heard of a peer support worker at some point. Typically, whenever we think of peers, we think of substance use disorder services, we think of mental health, and that's primarily because our certification for peers in the state of Illinois is really geared towards the CRSS or the CPRS. So it really focuses in on those kind of behavioral health things. However, the state has really recognized, and even beyond the state at a national level, people are really starting to recognize the importance of integrating people with lived experience into all of the different areas of the service landscape, not just isolating them to substance use treatment, recovery services, or mental health services. So, we're going to talk about what that looks like today. Here are some of the goals for our time together. We are going to discuss the distinct roles and functions of family peer professionals. This is something that I really enjoy talking about because it's a very broad thing, and I also think about with my own lived experience the impact of what my what my experiences with some things could have looked like if I would have had a family peer to walk alongside me. We are also going to examine some evidence supporting the integration and the importance of the family peer professional workforce, and we are going to discuss strategies for effectively integrating family peer professionals into multidisciplinary teams. So I want to circle back around here to this question, okay? And I know what I think, right? I know what the research says about why we need to talk about family peer professionals, but I want to know what you think. Why do you think discussing family peer professionals right now, given everything that's going on in the world, given, everything that's going on at the state level, at the regional level, why is this important? Why do we need to have a solid understanding of what a family peer professional can offer and how we integrate them into our programming? Why is that important? Okay, that is good to know. There are a few CFPPs, the Certified Family Partnership Professionals. Nancy, you're one of those. I, and there are only a handful in the entire state. So awesome. Awesome. Why is it important to talk about family peer professionals right now? Why is it important to think about the importance of really integrating that element of lived experience into service systems beyond substance use treatment and mental health? Why is that important? Families may trust peers more than other service providers. Support is huge. Yep. Hitting the nails right on the head there. Absolutely. So the very first one, that is 100% true. And I will say that at the state level, that is kind of the loose reason, if that makes sense, behind the push towards family peer professionals. I also see Jasmine's comment, peers have such a unique experience. I think in being able to meet families wherever they might be. Yep. Yep. Oh, thank you, Elizabeth. I'm so excited that this information's new. I love that because then that means you're going to learn something. So that is fantastic. That is fantastic. Families need help with connection to their community and their resources. Yep, knowing that families aren't alone in their challenges and divisions and that help is available. Absolutely. Yep. All of these things are exactly why we need to be talking about this role right now, and not just talking about this role, right? We need to be actively kind of examining our programs, examining our organizations, and understanding where do family peer professionals fit within the services that we are providing? How can we make that work? At the state level, for like I said, for a long time, I would say for probably the last 5 to 10 years, when we think of peers, we kind of silo them into the substance use or mental health areas. But we're starting to see now over the last couple of years that these systems are a variety of systems are starting to really understand the benefit of having this role, right? So we are seeing family peers in medical systems. We are seeing family peers in behavioral health care systems. We are seeing family peers in DCFS and child welfare systems, which is just phenomenal. We see them in court systems, and we're actually even starting to see them in educational systems. Are there any systems that I left off that you're like, oh, what about this one? Yes, Nancy, I saw your hand there.
Up in Will County area, they're doing some using with seniors who are grandparents. They've
Hmm.
got some peer navigator projects up in that area that they're working on.
That is fantastic. And so, Nancy, I'm going to ask you if you don't care, because I know that you have that lived experience yourself of being a grandparent raising a great grandchild.
Right.
What would your experiences have been like if you would have had someone, say a family peer, that could have walked alongside you through that?
Well, considering that I've done two different generations, one through the system and the other by voluntary service, it would have made a big difference because even being in this field as many years as I have and knowing what I know, I didn't know those steps to take to get the
Hmm.
help and the resources that we needed. We're fortunate. I'm still employed, obviously, that we can afford to do it, but so many that I've ran into don't. And to me, having that person walking by your side would have been a tremendous help. That's how I found out about Child TANF was through somebody that had had that experience.
Hmm. Absolutely. Absolutely. Yeah, and so you talking about that makes me think of my own lived experience of being a parent of a child diagnosed with autism spectrum disorder. And so I'll give you guys just a little bit of information about that, because I think it is very relevant to this conversation, and really, really relevant to why this information is so important, and how people from all demographics. It doesn't matter what your background is. It does not matter if, you are a service provider. People from all areas can really benefit from that peer support, especially whenever it comes to family circumstances. So, I am a mother of three children. I have my one guy in the middle. He's sandwiched between two very bossy sisters. God love him. But he was diagnosed around age 4 with autism spectrum disorder. At the time of his diagnosis, I had suspected, because I had been, my bachelor's degree is in special education. So I actually taught special ed in schools. And then my master's degree is in social work. So I had been working in child and family serving systems for quite a while at the time. And so I knew probably about the time that he was, I would say, 2.5. I knew that there was something that was different about Avery. He did not necessarily show kind of the hallmark characteristics of autism, if you will. Like, he made eye contact, he smiled, he did these things. But the older we get, or the older he got, once we got into kind of that, pre-K age, so 3 to 4, we really started struggling with just absolutely massive tantrums. I mean, any type of it was we could really kind of time it like clockwork. Every night between the hours of 5 and 8 p.m., Avery was going to have a tantrum, and he and I would end up in another room, away from my other two children, away from my spouse, and we would just have to basically ride out the tantrum. I didn't know what to do to help him. I knew that this tantrum was not the result of him behaving badly. It wasn't anything like that. I knew that there was something else going on. And so at the time, I was working on my master's degree in social work, and I was doing an internship with a clinical psychologist who just so happened I was able to get him in for an assessment to determine if, or for a diagnostic assessment for autism spectrum disorder. And even though I had worked in this field, even though I knew so much about autism, I knew so much about, the treatments and the interventions and all of the different things for autism spectrum disorder, I will still never forget getting that psychological report and reading it and seeing in black and white on paper, diagnosis level 1 autism spectrum disorder. I will also never forget reading on that paper, diagnosis developmentally delayed, all of these different things. And I'm looking at my 4-year-old and I'm like, Okay, I can understand autism spectrum disorder. Like I said, I kind of prepared myself for that. Even though I prepared myself for that, though, it definitely did not negate the feelings that came with the confirmation that that is what was going on. But looking at this information, I remember just sitting there and crying because even though I knew what was going on, even though I was educated in what was going on, and I was expecting that this was going to be the diagnosis, suddenly the plan or the idea that I had imagined for my child's life looked completely different than what I had imagined till that point. And that is the reality of so many families that are navigating these extraordinary circumstances. I think about during that time when we were trying to figure out, what type of therapy he needed, what type of supports he needed, and then once he started getting into school, whenever we were talking with the school about, okay, can we get an IEP? No, you can't get an IEP. Can we get a 504? Yes, we can do a 504, but we're going to do as few accommodations as possible. I remember those feelings of I should know how to do this. I'm in the field, right? I've been through this. I've been on the other side of this table. I've been in the IEP meetings as a teacher. And yet here I am sitting as a parent and I'm absolutely terrified because this is like Nancy said, whenever it becomes your child, any pre-existing knowledge that you had, regardless of if you were a service provider or not, it does not apply. It just absolutely doesn't. It's like it goes out the window. And so I think about this, and whenever I started really learning about family peer professionals, this was the thing that really drove it home for me about how impactful and important this role actually can be. I think about how beneficial it would have been for me to have someone walk alongside me in that moment. Now, I will say, I had informal family peer professionals at that time. There is one individual here in Southern Illinois that she was a colleague of mine, and I knew that her son was a little bit older than mine. I knew that he was diagnosed with autism spectrum disorder, and I knew that she had been doing this and knew how to navigate this system. So, what's the very first thing that I did? I reached out to her. She was an informal family peer for me in that moment, and she has continued to do so over the last 5 years. This is why we have to talk about this. So even outside of the service landscape and all of these different systems where we're seeing family peer professionals come up, I want to dial it back just a little bit, okay? And I want to, if you've heard me present before, you know I love talking about parents, right? I love talking about parents and really humanizing parents because I think it is so easy in this work for us to forget just how human parents actually are. We put so many expectations on them. We ask them to navigate systems that are not built for them, among other things. And so I want to dial it back just a little bit, and I want to boil it down to something that every single parent, every single caregiver is familiar with. Okay. And that is stress. Stress. So, my first question here is, so you see this picture, parents under pressure. Has anyone seen this document before? Seen or read this document? No, I'm watching the chat to make sure. No, okay, I see no's. Okay, all right, good. So I'm going to give everyone a challenge here that after this is over, I want you to Google and download this document. This is from the US Surgeon General. Okay, it was published in 2024, and this is a policy statement that the US Surgeon General felt was so important that he actually felt the need to discuss the stress and pressure that parents in the modern world are navigating. This is such a significant challenge that, again, the US Surgeon General felt the need to release a whole official document on this, talking about these things. So let's look at this information, okay? So, one, we know that parenting is reaching a crisis point. This again was published in 2024. I would wager that we are very much still at a crisis point, if not past that crisis point, given everything that is going on in the world. We know that there's so much good information in this document. So I really do encourage everyone to download this and read it. It really is worth your time. But just some highlights from this. About 1/3 of US parents report high stress levels. Now you may say, yeah, of course, they're parents, they're stressed. Yes. But nearly half of those 1/3 say that their stress is completely overwhelming to the point that they cannot function. And that's in comparison to just 1/4 of people who say that are non-parents. So we can see right out of the gate there that there are big disparities in stress levels, pressure levels, and all of these things between people who are in that parenting or caregiver role and people who are not in that role. The next thing I want to talk about, and this might sound a little hooky maybe, but I feel like this, if we really think through this, this makes a lot of sense. This statement that modern life is biologically not sustainable for caregivers and parents. Whenever we say that, we're talking about the rising work hours. We're talking about the increased financial strain. We're talking about the loneliness that comes with being a parent, right? That's something that I reflect on a lot is how can I live in a home with 3 other people and feel lonely? Right. But that is one of the roles, that is one of the burdens of being a parent, right? It's just part of it. It can be a very lonely thing. We also have unrealistic cultural pressures that combine all of this stuff into overload that really impacts a parent's ability to navigate stressful situations. And those are just a handful of the situations that parents are dealing with on a daily basis, right? We're also thinking even down to the basic needs level, right? You have so many parents in our communities that are worried every day about what am I going to feed my kids when they come home because there's nothing in the fridge, right? I hope my kids had lunch at school. I hope that, if it's the weekend, the school maybe sent some extras home because we are between SNAP benefits right now and I can't get to my food pantry. Or, we think about parents who are trying so hard to make sure that their children have access to all of the things that they never had, and they still are coming up short because of finances, because of time, right? Because of the ability to get to the thing that they need to get to. All of this is really a big part of modern life that is not sustainable for most caregivers and parents. We are not meant to parent and raise children in the type of world that we are currently parenting and raising children in. We're just not. Now, does that mean that we stop doing it? Of course not, right? We know that life goes on and that we adapt, right? But the thing is we really do have to remember that the amount of pressure that parents are under right now, it really is beyond what is sustainable for most people. We also know that parental stress is not just an emotional thing, right? It's not just emotional, it's biological and it's generational. What do you think that means? I'm curious about everyone's insights on that statement that parent stress is not just an emotional thing, it is biological and it is generational. What does that mean? Or how do you interpret that? You don't deal with it now, bingo. If you don't deal with it now, your kids will have to. Yep, absolutely. Any other thoughts and comments on that? Yes, John, this is live. You actually can chat. You can get physically sick from the stress. Yep. Stress is passed down from prior generations. Generational trauma. Yep. Absolutely. 100%. We know that chronic stress disrupts the parent's regulation, right? It disrupts the chemical balances in their brains. It disrupts their brain's ability to regulate with their emotions. And it impacts not just their brain, but it impacts their physical health. And it changes things so much, especially when we're talking about chronic ongoing stress, that we actually can end up passing on some of these epigenetic and environmental pathways to to our children, right? Making them potentially more prone to certain types of stress, making them less likely to be able to handle the stress in a healthy and safe way. So this isn't just about like, okay, mom is stressed out, mom needs a day off, mom needs to go take a hot bath. It is so much deeper than that. Right? It's so much deeper than just looking at the person that's in front of you. When you are seeing a parent that is stressed out, especially if it is a chronically stressed out parent, to the point where that person and their functioning is interrupted and all of these things, you are kind of seeing a little bit of the writing on the wall for future generations if something doesn't change, if something doesn't get better. Not only that, but parent stress, stressed out parents, are those parents going to be able to really help co-regulate their children, help keep them emotionally regulated, keep them emotionally calm? No, they're not going to, right? They may be able to, but it's going to be a challenge. A dysregulated parent is going to unintentionally create a dysregulated home. And that is just unfortunately the fact of the matter. Now, again, I am not saying that any of this is the parent's fault, right? I'm not saying that any of this is anything that, a parent should be ashamed of. These are just the facts. If a parent is stressed out, they are going to be less patient. They are going to, potentially yell more. They are going to, not be as emotionally available to their children for that attachment, for that bonding, for all of those things that than a parent who is less stressed. We know that it's based in research. And so whenever we think about these things, we have to think about that even though even though the parent may be experiencing this, we have to remember that it goes so much farther, right? The parent is the head of the house, and it does not stop with them. It continues to the children and future generations to come. We know, and I love data, so I just wanted to share these, but I'm not going to harp on these for too long. But this is some of the information that came from that report, as well as a report from the National Federation for Children and Families. We know that 50% or more of parents or caregivers of children with disabilities report stress at a clinically relevant level. Now, that one I am going to harp on because this is important, okay? 50% or more of parents or caregivers of children with disabilities report stress at a clinically relevant level. Why is that important whenever we're having conversations about prevention, when we're having conversations about child engaging families who are potentially at risk? Why is that important information to know? This one might be a stretch, but this is very important. When we think about children with disabilities, what the research has shown us is that they are more likely to experience child abuse and maltreatment because of the disability, because of the additional stress and pressure that that disability may create. Yep, I'm reading some of these comments. Absolutely. Chronic stress while the mother's pregnant also yes, absolutely. Creates confusion of who they are. More stress than the average parent. Populations require more care and are more vulnerable and therefore more likely harmed. That's exactly right, Alicia. You hit the nail on the head. We have to know that, right? And again, that is not me circling things back around and pointing any fingers at parents. These are just things that if we are really going to understand the scope of the challenge, we have to recognize that parents of children with disabilities are experiencing higher stress, and that does place the family and the children potentially at greater risk. It just does. We also see another one that sticks out with me. Well, there's two here. 48% of parents say that stress is completely overwhelming on most days. 48%. So I like to take those numbers and boil it down into something like 1 in 2 parents, nearly 1 in 2 parents say that the stress levels that they are experiencing are completely overwhelming on most days. 41%, so just a little bit less, say that most days they are so stressed that they actually cannot function. That comes out to about 2 out of 5 parents. Okay. This is a much bigger problem than what so many people realize. And the thing is whenever we are talking about families and parents, we have to realize again, it does not, these are not things that just impact the person experiencing the stress. Because the person is a parent, it is absolutely going to have tremendous implications on the child and on the family's ability to navigate life successfully. I want to give this example here. So take the Illinois Children's mental health system. Okay, if you've ever tried to navigate the Illinois Children's mental health system, you know exactly what I'm talking about here. Okay, now I am not going to sit here and say that no one is doing anything to try to make this better. I completely disagree with that. There are a lot of people that are trying to make this better, especially at the state level. I have been fortunate enough to be part of conversations, with HFS, with DHS, with all of these different, entities that are involved in the children's mental health system, and listen to them talk and brainstorm. Okay, what is the challenge, right? What is the issue? So as that's one of the reasons why the state of Illinois has started working on this Illinois Blueprint for Children's Mental Health. That's another document that I'm going to encourage everyone to look at because it gives you a lot of good information about the current state of the children's mental health care system in Illinois and where the state is headed. That plays specifically into what CIRAC, our designation as a family-run organization, standing up 7 family-run organizations across the state of Illinois was an effort directly facilitated by the state in an attempt to engage families using peer parents. So it's not this confusing, convoluted system is not here because people aren't trying to fix this, right? It's not here because the powers that be don't think it's a problem. They absolutely see the problem. They absolutely understand it. This quote here on this slide is from this state document, the Illinois Blueprint for Children's Mental Health. They pointed out themselves, there is no single coordinated point of entry for children's behavioral health care services in the state of Illinois. We're not lacking effort. We are lacking coordination. We are lacking accessibility, right? And so whenever we think about these things and whenever we think about just this massive system, it's not only about the massive number of children who need support services that aren't involved. It's not only about the parents who need services for their children that aren't able to get those services because they're placed on a wait list. This is so much bigger than that. This is about infrastructure, right? Families often have to figure out how to access these services on their own. We know if you've done this or if you have worked in the field long enough, you know that most of the systems that a family would interact with whenever they're trying to get their children into mental health care, those systems typically operate in silos, right? They operate independently. So you may have to complete multiple intakes. You may have to tell your story multiple times. Your child may have to tell their story multiple times. It is so much more convoluted than what it really needs to be, right? And again, it's not because people aren't trying to make it better. It's not because people aren't trying to make a difference. This is just the system that we're currently working with. So circling this back around to family peer professionals and where they come in. We're not talking about family peer professionals as extra support, okay? We're not boiling it down to that. We are literally talking about a role that compensates for a structurally complex and fragmented system. We're talking about a bridge between our families and between this convoluted system, right? This is the mental health system. It is just one example. As you all know, there are multiple. So I just want to give I don't know, a little story, I guess, here, and because I feel like this grounds it in reality, right? This story is not anything that is going to be new to any of us. It's probably a story that you've heard or witnessed or experienced probably 100 times. So let's say you're a parent, you're in a rural community. I always go rural because that's where I'm from. But you're in a rural community. Your child is struggling in school. You think that that kid may have ADHD. You have Medicaid. You don't have a car, or you don't have consistent access to a car. And someone at the school has mentioned DCFS because your kiddo has been absent multiple times. They've mentioned a potential hotline call. So you're a parent. You are not a service provider in this instance, right? Where do you even start? You've got so many factors going on there. You know that something is going on with your kiddo. You think that it might be ADHD, but really you don't know, right? You know that you have Medicaid, so you know that the providers that you're able to access are already limited, right? Especially if you're in a rural community. If you are able to get your child into some sort of therapy services or treatment services, you have to figure out, okay, how am I going to get them there? Right? How am I going to get them to their therapy appointment? How am I going to get them help whenever I don't have a car? I don't have someone that can reliably take me. Um, and those are just a few of the issues, right? And then you've got this looming potential DCFS over your head as well. So where do you even start, right? I mean, just me thinking about that, like it makes me feel anxious just even thinking about that, you know? Who does the family call first? Where do they start? Do they talk to DCFS? Do they try to get the kid? Do they talk to the school? Do they try to get the kid into therapy? Do they talk to the pediatrician and try to get a diagnostic assessment? Where do they start? There's no right place to start, right? There's no single coordinated point of entry for mental health in this state. And then on the opposite, what happens if they start in the wrong place, right? What happens if they start in the wrong place? Then, unfortunately, we have the challenge that families often face where they get gridlocked in a system. They're on a wait list and they think, okay, well, this is where I have to start. And now we're just waiting while all of these things, life, everything else is still going, right? All of this is to say that the problem is not the families, okay? The problem is not the families. Too, too often in this field, too often in this work, we are so quick to blame our families, to blame our parents. The problem isn't the families. We are asking families to navigate a system that's built for compliance and for funding. It's not built for family navigation. So here are some of just a handful of the challenges that families deal with whenever they are attempting to navigate this system, right? Fragmentation of services. You have one organization that you're working with, and then you have another one, and they don't talk to each other, right? Even if you do sign the release of information, they still don't talk to each other. You have eligibility barriers. You have workforce shortages, which lends to long wait lists and long wait times. And I will tell you, as the parent who was told that it would be a year before my child could even get in to be assessed for autism, there is no more helpless feeling than knowing you are on a wait list with nowhere to go. Inconsistent communication from these systems, access challenges, and rising needs that, frankly, our structure, our infrastructure, and our systems are not equipped to meet. We do not have the capacity to meet these needs. So again, that points to the importance of the family peer professional role as being a bridge between our families and the current systems that we have. We see this so often, and this is, we see this disconnect, right? And if you want to share in the chat kind of, if you have an experience that immediately just jumps into your mind about this disconnect between what families need and what the system is actually designed to provide, I would love to read that. But we know, right? We know that families need to be trusted, right? They need to be trusted, and they need to have a relationship with they need to be able to trust the provider that they are working with. We know that they need consistency. They need to know that, that every week at this time, this person is going to show up, and if they're not going to show up, they're going to let me know. The parents don't just need to know that, the children also need to know that. They also need advocacy. Again, I want to take you back to what I said about, navigating a 504 meeting for the very first time, being someone who has a master's degree, who also was a special education teacher, and feeling absolutely terrified in that 504 meeting because I did not know sufficiently enough how to advocate for my child. I knew I was supposed to. I knew that if I didn't, that the people at the table would probably talk about me after I left because I've heard them do it, right? But I did not know the right way to advocate. Families need autonomy. They need the ability to make decisions based on their own experiences. Families are the experts in their own lives. They also need options, right? They need to have the ability to have a voice. This is one of the things that I really appreciate that the state of Illinois is doing, is really amplifying and raising up the voice of parents and families with lived experience, because who better to help inform the design of systems, policies, and all of these things that are really currently gridlocking our people's ability to get support than the people who have had to navigate those, right? It's so much better than just kind of guessing about what may work. These are the things that parents need. But unfortunately, oftentimes what our system is designed to provide are referrals, requirements, timelines, restrictions, right? And again, that's not a dig at the system. It's not. The system is doing exactly what it's built to do, right? It is. But it doesn't change the fact that the system, the current way that it is broken. And it is also very full of barriers and access challenges that are really impacting families' abilities to be well. So this is where family-run organizations come in. I know we have a variety of different professionals here today, and I'm gonna use the term recovery community organization because, in my experience, that is kind of the most simple comparison to explain what a family-run organization is. So a family-run organization is an organization that has 51% or more of its leadership, board, and staff that are people, parents with lived experience of caring for a child with some sort of additional need. It could be a need related to child welfare involvement. It could be a need related to a learning disability, medical complexities, mental health, substance use. It is a very broad umbrella, but a family-run organization intentionally highlights the experience of the family as being a part of the lived expertise of this organization. So CIRAC, as I mentioned in the beginning, is a family-run organization. We were fortunate enough in January 2025 to begin a planning grant with the Illinois Children's Healthcare Foundation, where they were working with the state of Illinois to stand up 7 family-run organizations around the state of Illinois. You have one represented in here through Sarah Winkle, the executive director of Project Sun in Kankakee County. And so I would encourage everyone to look into these. I believe we even have a page now on the DHS website talking about what a family-run organization is. But this is the state's recognition that there is power in peer parents, that families are disconnected from the system, that we are not engaging families in a way that allows them to use their voice in a way that promotes that trust and that relationship and connection. And this is the state's way of saying we need to build a bridge between the system as it currently is and the families that may be engaging with the system or but are limited in their engagement, or the families that we are not capturing, right? So family run organizations, I like to consider them systemic bridges. There's a really good website that has a lot of information about what an FRO is, what it does, and what the models can look like. And that is the Family Run Executive Directors Leadership Association. So FREDLA is what the acronym for that is. If you want to know more about that, I would highly encourage everyone to look into that. But these are some of the core principles of a family run organization. It's community based, it's family governed, and it is entirely rooted in lived experience, from the policies and procedures of the organization down to the services that are delivered by the organizations. The core functions of these organizations are providing that peer parent support, providing navigation of resources, advocacy, and working to change the system. Our guiding values in family run organizations: voice, choice, collaboration. When we're talking about collaboration in this way, we are talking about the families that we serve. We are talking about the people that we serve. We know that family run organizations are not extensions of systems. We are partners, we are bridges in the system that center that family wisdom and really give a voice to what is going on with families in our communities. Family run organizations would not be family run organizations without family peer professionals or peer parents. You're going to hear me use those interchangeably in this, because they are really kind of one and the same, at least in my experience. But family peer professionals are highly trained individuals, right? So that has been one of the biggest things that we have discussed in our FRO cohort is, and we've discussed this with multiple state agencies and things like that, is the need for other organizations like CCSOs and CNAs and all of these other pieces of the system for them to recognize that an FRO and family peer professionals are not just lay folks, right? They are not just people who, have a passion for something and they're just going out there and, firing wild and all this stuff. No, family peer professionals are highly trained individuals who use their personal lived experience with challenges and systems to support families that are navigating extraordinary circumstances. Like all peer professionals, family peer professionals use the relationship as the intervention. It is all built on that connection, right? So family peer professionals aren't just helping families, they are actively navigating these high stakes, complex systems alongside the families. Most of the time, in the typical service landscape, this is not something that, say, a social worker would necessarily have time to do, right? They don't have time to help a family fill out an application for EBT. They probably don't have time to help a family fill out, or schedule an appointment for, a therapy session. No, but who can do that and who can honestly probably do it better than a social worker, and don't take that offensively, I am a social worker and I still stand by that, is a family peer professional. It is because they have likely done it themselves. They've done it as a parent seeking help, and now they are going to walk alongside a parent who needs to navigate that system as well. So family peer professionals break cycles through three different pillars: mentorship, parent support, and advocacy. So I just want you to think about here, and this is something that, again, I always circle back to this because I feel like it's so easy when you're a service provider, especially working in a high demand position, working in a position or working, where you may be experiencing burnout, compassion fatigue, all of these different things. It's so easy to forget that parents and families, they're made up of humans, right? They're made up of humans who make mistakes, of humans who get overwhelmed, humans who don't have all the answers. It's so easy to forget those things. And in doing so, it's also really easy to forget about all the times that we ourselves have had to navigate new systems. We've had to learn how to handle a new situation, or we've had to face a new challenge. So I just want to ask a quick question here. When you think about a time that you had to learn something new, what was most helpful for you on that journey, and what was least helpful for you on that journey? We've all had a mentor, a coach, a friend, a peer, someone that helped us at some point in our lives. And they were able to help us because they had been through it before. Yeah. Yeah, John, I see your comment. Such an important thing to provide. You can't learn every single form for every single public local resource. Often those who have engaged are the only ones who provide real advice. 100%. Yes, yes. So something I see Tiffany using plain language. Elizabeth, I see when you adopted your son. Yep, yep, absolutely. Support and patience, support, no one size fits all approach, and realizing there's more than one way to do things. Yep, absolutely. The thing that I always come back to whenever I think of this question is when is at right after having my first child. At the time, I was working at Lutheran Social Services of Illinois as a child welfare specialist, literally teaching parents how to parent their children, young little 23-year-old Megan, teaching parents how to parent their children. And I will never forget the night that we brought my oldest child home from the hospital. And I remember standing in my living room, holding her like this, a newborn, holding her like this and crying. My mom was standing there and crying and saying, Mom, I don't know what to do with her. I don't know what to do. And in that moment, my mom's like, honey, yes, you do. You know what to do. You know how to handle this. You know how to navigate this. But I also think about all of the mom friends that I reached out to in those early days, right? Whenever, we had a diaper that was funky, or whenever, we weren't eating the way that we should, or, we had experienced colic. I think about the people that I reached out to for that, right? All of those people were people that had navigated these circumstances before. And that's why I reached out to them. That's exactly why, because I knew that they would be able to give me some solid advice. I knew that they were going to genuinely and authentically understand the stress and pressure that I was going through. And I knew that that would be helpful. What was not helpful was people telling me, like, oh, it's just a phase, right? Even though that's true, that's not very helpful whenever you say a new mom or something like that going through some challenging things. People who are there to hold space and share the knowledge that can only be gained from walking that journey are the most helpful for these families. And that is exactly what peer professionals do. Looking at the practice pillars here, we call these the practice pillars. So these are kind of the core tenets, if you would, of family peer professionals. We mentioned them on the previous slide. We have our parent mentorship. We also have our family support, and we have our family driven care. So what this looks like, and these are really just kind of some understandings that help to guide the role of a family peer professional, right? So the first one being parent mentorship. Like I said, whenever you are talking about anything peer related, but especially talking about a family peer, you have to realize that connection and support come first. Connection and is the foundation of that relationship. Without that connection, without a relationship, it is going to be a much less beneficial relationship. So, the first one here, our first pillar, is that parenting, we understand that parenting does not come naturally to everyone. That's not groundbreaking, but I feel like at the same time, we all need to be reminded of that, right? Parenting does not come natural to every person. We also know that parenting, while struggling with things like mental health, substance use, and all of these other challenges, is extra hard. Parenting's already stressful, right? But whenever you throw in additional things that are being experienced by the parent while they're also navigating parenthood and trying to raise regulated, healthy children, that's a lot of pressure, right? We also know that many parents have not had exposure to evidence-based positive parenting strategies. This is one of the biggest gaps in knowledge that I see, especially in our rural communities, that, typically parenting practices can be passed from generation to generation, right? They may not have knowledge of evidence-based positive parenting strategies. And we also have the understanding that every single one of us needs a coach or a mentor at some point in our lives. whether it's a formal coach or mentor, or whether it is just a friend that you call whenever you are in a pickle and you don't know what to do. Every single one of us needs a person that can listen and say, okay, the map and the path looks really hairy right now, right? You're in the middle of the woods, but this is one potential way that might start to take you out of it, right? Here's something we can do. Here's a compass, here's a flashlight. Let me help you. Let me walk alongside you. Every single one of us needs this. The second pillar of family peer professional work is it gets rid of the hierarchy in this professional versus client relationship. At CIRAC, we try, and it's been a shift because again, I'm a social worker, and so client is my programmed word, right? But whenever we think of the people that we work with, we try really, really hard to make the language shift from being a client to being a participant, because a client, automatically the word has that hierarchy built into it, right? You're the client and I'm the professional. You're the client, I'm the provider, right? And so you can be the most relational, savvy provider, you can be the most authentic, non-hierarchical provider. But the fact that we still are using language that others, the people that we're supporting, that's still an issue, right? We have to be aware of that. We also, family peer professionals, are going to help families find their natural support system. They're going to educate the family on the options and alternatives that are available for whatever circumstances they're going through. They're going to empower the family to make the changes that are necessary. This is a huge part of this, right? When it comes to services, when it comes to any type of family support services, whether it is with a peer, whether it is with a clinician, whatever, the goal is never and should never be for someone or a family, a parent, a child to be involved in services for the rest of their lives, right? That is a reality that we forget so often in this profession. We have to remember that our goal is to be there for a short time, help to stabilize the situation, remind the parents who they are and what they can do, right? And really build up their confidence, their self-esteem, and their own belief that they can handle these things. And then get out, right? That's our roles. That's what we do. And family peer professionals are no different. We also help them to troubleshoot barriers and challenges that may arise. One big underlying factor of all of this is family driven care. This is probably not a super new concept, but this is something that I think it's worth refreshing, because it's very easy to forget this whenever you are yourself integrated or navigating some of these larger systems. Family driven care acknowledges that families are the experts in their own lives. That is it's at the center of every decision that impacts their care. And I'm not talking about that we have a child family team meeting and just check a box. That's not what I'm talking about. I'm talking about that we literally get to know the family. We ask the family to, we get to know the family in a way that helps us understand what are the strengths that are already there? What are the challenges that are there? How do we help empower this parent to take control of this situation and to help, move their family towards a better place? How do we do that? Well, this is another part of this. This is peer parents and the four domains of social support. All peer work in general, whether you're talking about family peer work or peers that work in the justice system, peers that work in behavioral health settings, whatever, all peer work typically lands in one of these domains at any given time, right? So we have our emotional domain, we have our informational domain, we have our instrumental domain, and we have our affiliational domain. Each domain has different benefits for different circumstances, but we have these four domains of social support because that, again, that relationship and that connection that families that really sets peer support work aside is at the center of everything that a peer does, including peer parents. So oftentimes systems focus very heavily on the informational domain, right? They focus on the informational domain. So we're going to give you information about potential resources. We are going to, help you understand what your eligibility benefits are, what different things you might qualify for. And all of those things are wonderful and extremely helpful, right? They are very, very helpful. But it's not a complete puzzle whenever we're only taking one thing, right? So our systems are typically designed to be more informational, possibly instrumental, if that makes sense. But emotional and affiliational support, those are two domains that are really, really unique to peer support work. Okay. They're very unique to that because they rely again on the relationship as the foundation and on that lived experience connection that cannot happen in many other professional relationships. So I warned you all that we were going to talk about connection a lot today. And it's true. And it's because you can't talk about peer work, especially family peer work, without really hitting hard and driving home how important connection actually is. And that's not just Megan Reagan saying that connection is important, okay? This is evidence-based. There is research from SAMHSA. There's research from the National Federation for Children and Families. There's research from FREDLA. There's research from Chapin Hall. There is a huge body of research that supports the facts that family peer professionals are their work in connection actually does impact and improve outcomes for families that are experiencing adverse circumstances. So I just want to look at kind of this model here. Now, I try not to operate in absolutes, but I do like this. On one side, we have kind of our disconnection. We have, maybe a family that is isolated, a family that's not involved in any services. Maybe the kiddos aren't involved in any type of extracurricular activities. Maybe there are very limited family supports in place. So we have, disconnection, right? Where there is disconnection, there's vulnerability, right? Whenever you have a family or a parent who is disconnected from support services, who's disconnected from resources, that family is automatically just a little bit more vulnerable to some of the things that life can throw at us than a family who is well connected and well resourced, right? And I mean, just think about that. Think about, it's I'm sure you can think of a participant or a personal story at this, but you take someone, let's say you have two women and children who are leaving a relationship where there's domestic violence. Okay, in one situation, the woman has a strong family network outside of that relationship with her partner. She's already involved in some type of therapy services. She is, a part of the PTO at school. In the other circumstance, that woman and her children may be isolated because of the abuser, right? That woman may be not have any type of support, may not have any type of understanding of finances, of, resource availability, things like that. When we think about these two women and their children, and both of them are attempting to leave this, abusive relationship, we automatically know it doesn't take a rocket scientist to realize that this person over here who's already connected, whether it be to a personal, professional, service provider, whatever, this woman over here who's already connected, she is already starting 5 feet in front of the finish line or in front of the starting line, right? She's already starting a little bit ahead of the game because she has that connection to those things, because she's not navigating this alone. The other family, the other mother is going to struggle in different ways, right? She's going to struggle because she is entering unknown waters and doing it completely alone, doing it completely disconnected from anything. Now, people do this all the time, right? And we know that, and they do it successfully, but it makes it unnecessarily difficult, right? Connection is such an important part of this, that whenever we have connection at the base, we automatically have an increased level of resilience. We automatically have increased chances to bounce back from whatever the situation that's happening is. Then, whenever the more vulnerable we are, we see families run a higher risk of becoming involved with the system in some way, whether that's DCFS, whether that is behavioral health, whether that is truancy, whatever it may be. Vulnerable families are more likely to become involved with a system that will create more tension, more stress, more pressure for the family, and ultimately destabilize things more. Connection really is prevention. It really, truly is. FROs and family peer professionals are very intentional in recognizing this, right? In recognizing the importance of connection as being a resilience building factor for families. And we recognize that connection isn't just about having resources and information. Connection goes so much farther, to the point that family connection can actually help to create stability in the family. Here's some examples of this. This is, again, framing connection as a prevention strategy, as a prevention tactic. And this is right where our family peer professionals fit in here. We look at families as partners, not clients, right? They are our partners in what we're doing in creating solutions. They are not just someone that we're providing services for. We also recognize that families have different strengths, different levels of resilience, and different insights that are essential to shaping the supports that will actually be effective in what we're trying to help them with. We also recognize that lived experience professionals are credible messengers and connectors. I'm going to say that again. Lived experience professionals are credible messengers and connectors. I cannot say that enough. I feel like the peer support profession has come a long way in terms of being recognized as a credible professional. However, the family peer professional and family run organizations, we still have a ways to go. We really do. And conversations like this are exactly how we become seen as credible professionals. We also put the phrase "nothing about us without us" into action. We are intentional whenever we are trying to elevate the voices of people who are actually experiencing these things, people who are actually living these circumstances. This helps us to design better programs. It helps us to better understand outcomes, and it helps us to understand how to help families in a way that is actually going to benefit them, right? So this slide may look familiar because earlier we had it and there was a big broken link there in the middle, but now we're going to put family peer professionals in there. Like I said, FROs and family peer professionals are systemic bridges that bridge what families need and what the system is able to provide, right? There is, again, so much information available through SAMHSA, through all of these different national and state organizations and agencies that really does highlight just how impactful a family peer professional can be on the resiliency and the life of families who are navigating adverse situations. So we've talked a lot about why family peer professionals are important, right? We've talked a lot about the importance of connection and how that really is the foundation for family peer professional work. But we haven't talked specifically yet about what do family peer professionals actually do, right? Well, there's, I'm sure, some things that we can all kind of guess, like a family peer professional can, attend an IEP meeting with a family and help them understand their rights, right? A family peer professional can help connect a family to, SNAP or EBT benefits. But beyond that, what do they actually do? Well, they actually do a lot. They connect with the family, obviously, through that shared lived experience. That provides some collateral, some clout, if you would, that a typical clinician or typical caseworker is not necessarily going to have. They engage in policymaking and advisory groups. Family peer professionals reduce isolation and provide validation so that they can foster resiliency in families. They provide education, they provide information, they help families through problem solving, they teach skills. They also facilitate access to services and supports for the children and the family. They help to participate in evaluation, research, and CQI activities. They provide training for families, providers, and communities on a larger scale to really help other service providers understand how best to work with families who are navigating these challenging situations. And they also model effective advocacy and collaboration skills. All of these things are kind of a 10,000-foot overview, if that makes sense, of what a family peer I did not mean to go backwards, of what a family peer professional does. Now, luckily, Fredla has given us this beautiful graphic that gets it a little bit down to maybe the 2,000-foot view, right? So I'm going to give everyone a chance to look at this, and I think you'll see that a lot of this information, a lot of these things might already fit into the system that you're a part of, right? So let's say when we're looking at our dark purple at the top and we're looking at system changers, again, we're talking about family peer professionals and how they can participate in policy advocacy, systems change, evaluation efforts, all of these things. They can provide lived expertise on policy committees, so they can be the person in the room, in a room full of people who maybe have never had to navigate the Medicaid system, saying, hey, this is a really bad idea because I've done this and I know this is going to be a barrier, right? This is something that's going to come up. Looking at our children and youth systems, they can participate on planning teams. They can establish connections to community resources. They can support the development of life skills. That's such a huge thing for our youth. Looking more at our agency facilities, the family peer professionals can, gather that information from client satisfaction surveys. They can be partners in that care coordination dyad where they are helping to get the family set up with whatever services they need, which again takes that burden off of families and helps to make the access points a little bit more centralized, right? If you have one point of contact versus 3 points of contact, that makes a huge difference whenever you're talking about services for your children or family. In managed care organizations or healthcare facilities, they can inform medical necessity criteria. They can help with outreach and enrollment. They can do follow-ups. They can coordinate discharge planning. They can do they can provide advice and expertise to the MCO regarding the experiences of care because they have likely navigated it themselves. There are so many things, so many roles that a family peer professional can do. And this graphic specifically includes family-run organizations and family peer professionals. Now, boiling it down a little bit more into some more concrete examples, these are the things that we are often helping with at CIRAC, or that we are in the FRO cohort that we're a part of. These are things that many of our cohort members do as well. So these are, again, just some examples here of what a family peer professional can do. I'm sure, like I said, you're seeing things that are already happening in your systems, right? And I want you to think about that if these things are already happening and maybe it's being done at this point by, say, a social worker or a case manager or a clinician or something like that, how might those outcomes change if we had someone like a family peer professional doing that instead of a clinician, instead of a provider, right? If we had someone that could come to them and say, hey, I've been through this with my child, with my family, and I know that this is really overwhelming right now. I know that there's a lot of information for you to go over. Let me help boil it down for you. Let me help you get through this. Let me help you figure out what's most important to understand out of this information, right? It is such an important thing. With that, Miss Nancy, I'm going to just open the floor for any questions. I'm going to look at the chat and make sure that I did not miss anything. And then I will hand it back to you.
Okay, we're doing pretty good. If there are any questions, I did
Okay.
I did send you a message. Did you see that?
Yes, I did about the CFPP. So,
Yeah.
so the CFPP, the Certified Family Partnership Professional Credential with the Illinois Certification Board, is being revised. They are revising it, and they're actually I'm thrilled they are working with the folks who are really leading up the work for the Illinois Blueprint for Children's Mental Health to revise that because again we're seeing now at all levels of the state and all different types of programming that peer professionals and especially integrating them into family services is really an important thing for the state to take on. So
Yeah,
it,
I just didn't
yeah,
want people to be
right?
looking for it and it's not on there and think,
Yeah, yeah,
oh my
yes,
gosh, because
yep,
our
yep,
director called me and says, it's not on there anymore. What's going on? So it will be available. And
yes.
it was time. It'd been around a while, so these all need looked at and
Mm-hmm,
revised.
mm-hmm,
So just
absolutely.
be aware.
Absolutely.
Let's
I'm
see.
just scrolling back through the comments here and I see one from Jessica that says that she's in the position of being a parent coach. She's young and she doesn't have children. So
Hmm.
she was relating, I believe, to my story about being a child welfare worker.
Right.
Wondering if there are any other trainings that can help with that. So yes, there are absolutely other trainings that can help with that. I will tell you the MTAC system, MTAC has a lot of really fantastic system of care trainings that are geared towards that family peer professional role. They're all free. You just have to sign up for the system and create an account, and then you can take the webinars. But I will say one of the best things you can do, and Jessica, I wish that someone would have told me this whenever I was in that position. Okay. One of the best things that you can do is remember and bring it back around to the realization that the families are the experts in their own lives, right? You're the parent coach, but that doesn't mean that you have to have all the answers. It's always good and it's a fantastic way to build relationships with families to ask them what's worked in the past. You know, how have you handled this before? How did your parents handle this type of thing? You know, get to know them, ask for their own expertise. It doesn't mean that it's correct, but that does start the conversation and that gives you the opportunity then to teach the correct way to do something.
Right. Yeah, meet them where they are.
Mm-hmm. Yep,
I think that that's what I've learned more than anything out of the peer aspect of all this.
absolutely. Absolutely.
Let's
Let's see
see.
here. Elizabeth, are people trained in most areas? If you have a peer professional that doesn't know a lot about IEPs, can you work with two different professionals? Yes, people are not trained in most areas. That's the thing. This is it's very unique. You know, a family peer professional who is who focuses on supporting families navigating the DCFS system they may not have any understanding of an IEP or educational advocacy or things like that. So we can't generalize and say that just because someone is a family peer professional that they're automatically going to be able to work in these different areas. All of that requires training, and all of that is again based on what is the lived experience of
Right.
that family peer.
Yeah, I will second that. I was
Oh,
just,
Barb, congratulations, 10 years having the CFPP.
I knew she had it. Yeah, I was just looking to see if there was anything that popped out here. What this shows to me, this was great, Megan. I knew it would be when we
Thank
talked about
you.
doing this last fall, is there's such a need and we need people that can promote that,
Hmm.
and in my role, it's always any chance I get, I'm going to say we have to meet families where they are. We have to include families with what we're doing. It's their journey, not ours. And um, this is this was great. I'll be ready to do it again.
That sounds good.
Okay. I think that's about the only other thing I will tell you is there will be a short Zoom evaluation pop up here. And if you take time to do it, I would appreciate it. But we will also be sending out a Google evaluation along with your certificate, and we would appreciate that being filled out. So that's about it. I don't know, are your slides available?
Oh, absolutely. Yeah. I'll download them and send them to you before I run to my next presentation.
Oh, well, or sometime between, in the next few days.
Yep.
That
Yep.
sounds good.
Absolutely.
Okay. I just so appreciate all the people that are on here, and the comments have been
I know
great.
everyone
I
was so
love it.
engaged.
So
It was
I'm hoping that
fantastic.
when I get off, that Zoom doesn't cheat me out of having copies of the chat.
Yep.
So, all right, everyone. Thank you. And if there's anything you need, I know that both Christina and myself have put our emails in here, and you will have Megan's available too. So, bless you all and talk to you later. Bye bye.
Bye, everyone.